cooperation of your fellow citizens Evans and Stein.
Good afternoon. My name is Gary Stein. I am a resident of Wesley Chapel, which means I am within the jurisdiction of Senator Legg and also Speaker Weatherford. And I've come here today to give you a different perspective on Medicaid expansion and why I would support it. First off, I have a master's degree in public health from the Johns Hopkins School of Public Health. I worked for the Centers for Disease Control for the better part of 2 decades and for the Department of Health here in the great state of Florida for several years. And I need Medicaid. I have a medically fragile family. My wife and kids have a genetic disorder called Stickler syndrome, which made my wife go blind in 2007, just a few days after we got here to Florida. One daughter who's had a retinal detachment and lost of vision, and one daughter who was trached at birth and was literally saved by Medicaid waiver. In 2011, after the downsizing of state government, I was laid off by the Department of Health. I didn't just lose my income and my job, but also my insurance. COBRA was a no-goer because it costs more than my income, and it was just not available to us. Well, thank goodness for the great state of Florida that had Medicaid for my wife and kids. Now, I'm not disabled or a kid, so I have medically needy Medicaid, meaning I have to spend about $1,500 before anything is covered. That means with this lack of full coverage, which would be fixed by this expansion, forces me to go to ER for care because I can't really afford it as a self-payer for primary care. The high cost of health care and the lack of insurance has created this culture of sick care we've heard about, which is not health care. We seek treatment and not prevention. We're reactive and not proactive, which means we don't go to a doctor until we're sick, which has a human as well as a fiscal cost. Now, there's a lot to be said about personal responsibility, but there's 3 things you need for personal responsibility. First, the means to be able to carry out what you need to do, which is what insurance does. Information, health information, which comes from screenings like high blood pressure, lipids, and cancer, which you get from your primary care physician, and the education to realize that information means that your health is at risk. Well, here's my story. Because of the fact that I was on Medicaid for the medically needy, I didn't go to my doctor, I didn't get my screenings. Just a few days after the last election, I had a massive heart attack, and I was brought to the hospital. And thanks to the efforts of the Florida Hospital Tampa, I survived. And I also thank Medicaid for taking my life. Don't think I'm not unhappy about this, because my blind wife has her seeing eye husband, and my kids have their dad. And I'm in the process of creating a 501c3 that's going to navigate patients away from the ERs. That's what I'm going to contribute for this. But instead of having Medicaid have a $200 bill for a doctor's visit and a few tests, what I handed Medicaid was this bill for $200,000 for my care. Now, as a constituent and as a Floridian who cares about public health, I find what I did to the Medicaid budget, terrible. Now, I realize that you have to put a face on these numbers and these policies. So I can tell you that I, in the faces of my family, are those who would be impacted by the Medicaid expansion.
Mr. Stein, could you please conclude so we can hear from Ms. Evans and Ms. Teeter?
Absolutely. I should mention that the only thing that kept me on my couch was my heart attack. But I am up, and I'm here to do everything I possibly can. We know that Medicaid expansion will do 3 important things for our state: strengthen and save the lives of individuals and families so they can work, reduce the impact of uncompensated care on hospitals, and reduce the impact on our state's Medicaid budget using those federal dollars that I put into all these years. So I ask you, for the sake of not just the 1 million that will be affected by the Medicaid expansion, but for the great state of Florida, please opt into the Medicaid expansion. Thank you very much.
Thank you, Mr. Stein. Ms. Evans?